The Career of a Medical Interpreter, Medio IGC 303, Unit 1. I'm Dr. Isabel Souza, and I will be your presenter for these series of presentations as well. So let's start with the job duties of the interpreter. Let's not forget that our primary duty is to interpret accurately and completely. We also facilitate turn taking as needed, right? Acting as the mediator, intervening when needing, to be able to interpret accurately and completely. All these other duties really support the first one. We have to address barriers to communication. And we've discussed all the different barriers that can occur, and they can occur from the very beginning all the way to the very end. So we have to be mindful of them. We have to address intercultural issues as they show up, and if it affects the communication or the therapeutic rapport. And we certainly have the job duty of advocating for the patient if necessary. And I'll just remind you all that when we advocate for the patient, we're typically doing it outside of the interpreting session, not as a representative of the patient, but simply as one more healthcare worker who is advocating for the patient well-being. So let's go to the next slide here, and we'll see some of the desirable personal qualities that we need to have in our professional self. So the first one is empathy and compassion. It's hard to work in healthcare if you don't have these qualities. They really, not just desirable, I'd say they're quite needed, because without it, we're not going to be able to be a good interpreter. So having empathy and compassion and the ability to see the other person's situation is very important. Professionalism is a must, and that starts from the moment we get hired to the second we step into an interpreting session, whether that's on-site or remotely, all the way to the very end of our conversation and our closure activities. Dependability. I like to say many times that usually interpreters don't lose their opportunities because of lack of technical skills. Oftentimes they may lose employment opportunities because of lack of dependability. The dependability is incredibly important in our work because, as you've heard all along, we work in different sessions. These sessions are short. So being there at the right time, at the right place, with the right attitude is incredibly important. You can be the best interpreter in the world, but if you show up 15 minutes late, you miss the whole thing. Confidentiality is a must. Being conservative and really minding, one's business and being very careful not to share anything that shouldn't be shared is important. And being detail-oriented. I've spoken about, the importance of accuracy. You can't be accurate if you're not detail-oriented. And that's also very important in any profession. Ethical qualities are very important. They show the ethical treatment of all parties involved, respecting ethical boundaries and understanding our ethical limitations are very important, and treating any ethical dilemma with utmost care. And of course, being patient safety minded. That's another desirable quality, because patients come first. Patient-centered care is what's going to make us successful. So moving on to the next slide. Let's talk a little bit about professional appearance. The healthcare environment is conservative, and if you work as a staff interpreter, maybe you can use scrubs in some hospitals, but typically, it's a business attire, a blazer, a jacket, pants, a dress or skirt. And, I think I've always done this myself and recommended other interpreters to do this. If you walk in with a patient, the provider should know who's the patient and who's the person that's the interpreter and who's going to help him, the person who's actually working. If our attire looks like we're another patient, it gets difficult to get the respect that we deserve. So I'm not saying you have to, overdress, but certainly people should see that you're in a working attire and not, dressing in a way that may be a bit scandalous or going to a party or simply, coming out of your house. So if we want to have a professional demeanor, professional appearance is a must. Yeah, it also includes, in hospitals, there are certain issues, hair, scents, having your hair all over the place, having scents is strongly discouraged. Many hospitals actually discourage scents, jewelry that can be pulled on if you're working in a place where patients are unstable. They can use it to hurt someone. No open-toed shoes. Many hospitals have those rules if you work on-site. And of course, fashion trends in moderation. Just be conservative if you want to be respected. Now, some of these comments are mostly for on-site interpreters or also called face-to-face interpreters. But if you're working remotely, just be careful to have a very professional demeanor as well. It really sets the tone. And sometimes interpreters will say, oh, I don't know why I'm not being treated as a professional. Well, if you don't talk or look like a professional, it's going to be hard for people to see you as a professional. So let's move on. And, a few more do's and don'ts about professional appearance. Dress like the people in the positions above yours. That's a great advice because that's going a step further. If you really want to stand out, then be even more polished than most. That's how people stand out. Do be mindful of the colors you wear. Navy is a traditional business color. Sometimes bright colors, there's nothing wrong, but they can be distracting for some people. And, sign language interpreters actually have a protocol of wearing very dark colors for that reason, so as not to stand out. Remember, we're there to provide, enhance that therapeutic rapport, so we don't want to stand out too much. Do wear some type of hosiery at all times, even in the summer. Again, it's just a sign of professionalism. And, hospitals are actually very cold places for prevention of germs and all that. Don't wear clothing that's outlandish, faddish, or seductive. It just gives the wrong impression. It's not that there's anything wrong with it, but don't be surprised if, your appearance also communicates a certain vibe. So you can't have it both ways, Don't wear heavy perfume or scents. We already spoke about that, but it's something that sometimes gets forgotten, and it's very important. It can be a problem in a healthcare setting. So moving on, a couple of professional skills. We've talked about the importance of the knowledge of medical terminology, anatomy and physiology, and disease processes. Just keep reading and studying constantly these issues so that the more you know, the more prepared you're going to be for any situation, and it will really make you stand out. When a provider, sees that you understand the terminology they're using, and that you can follow and even respond in the same manner with the same register, if you will, or technical jargon, it really gains the respect of those you're working with. Even if you're going to lower the register for some reason, you have to know the high register. Interpreting procedures and protocol, this is something that we need to know, and we're discussing here. And it's part of a profession, knowing the protocols to follow. Knowledge of the healthcare industry laws and practices can be very important. So I recall sometimes, remote interpreters have a hard time squeezing in their introductions because providers might not, they just start talking. And not doing as much remote interpreting now, but when I did, I would actually intervene and say, excuse me, according to Joint Commission standards, the interpreter needs to introduce herself to the patient by name and explain. And then I would do my introduction. And just by mentioning the Joint Commission, all of a sudden the provider had a respect for my work, knowing that I knew what I was doing and that the patient did need to know who I was. Because if a patient just starts listening to somebody on the phone interpreting, they don't know who that person is. So an introduction really eases the fear of, who am I sharing this information with? Where is this person? Having communication skills is also a very important professional skill. Oftentimes we think, well, we're just interpreting, so we're not really speaking. We're simply the voice of the parties. All this is true. However, every time you intervene, you need to speak for self. Every time you introduce yourself, you're speaking for yourself. Every time you explain anything, whether it's cultural, linguistic, or any situation at all, you're going to have to communicate your ideas and messages in a very clear, succinct manner. If you are having a hard time finding the words and communicating concepts, think about, how do I get to a point where I can just really have a ready set phrase that really explains my point of view in a polite and professional way. So communication skills are important. Now moving on to the next slide here, we have different places of employment that we work in, whether we're working or doing a practicum or an internship. Clinics, we've spoken about clinics, typically doing ambulatory or outpatient work. We work at hospitals, and if you work in a hospital, you're going to walk a lot because usually they're multi-building complexes these days, and you'll be going from one to the other. I worked in a hospital complex that we had to take shuttles between hospitals that were close together and were all part of the same system in order to attend our sessions. The emergency department, urgent care, physicians' offices, dental offices, all those are places of employment that will require us our work remotely or face-to-face. But in remote interpreting, also called virtual interpreting, online interpreting, but mostly remote interpreting. Distance interpreting is a term now used a lot internationally. So far, we have video or phone as options. And the phone can be different things, and we'll talk about that later. Let's move on to the next slide. And you will see a couple of employment trends and forecasts. The earning potential based on federal and regional economic factors is stipulated by the Bureau of Labor Statistics. And if you just go to their website, you Google Bureau of Labor Statistics, and you go to their website and you just plug in interpreters, you're going to see a whole section on translators and interpreters with, yearly average salary, growth estimation in the next decade, which, by the way, is higher than usual. And that's why the next slide here says the rapid growth of healthcare industry should provide opportunities for employment. And healthcare interpreting, also medical interpreting, they're called either interchangeably. They actually are, these are the specializations that are growing at the fastest rate for all interpreters. And that's really because the healthcare industry is gigantic and everybody needs to go to the doctor at some point or another. The participation in professional organizations can increase employability. So the minute you finish this diploma or even before, you can actually join these organizations with a student. They have student membership options, which are less than the regular membership. And this is a well worth annual investment in your career. I would recommend as a medical interpreter the IMIA mostly. ATA represents all translators and interpreters in all fields. So if you decide you want to work in another specialization, certainly the ATA can be helpful. CHIA is the California Association, and the IMIA is the International Medical Interpreters Association. So the IMIA has the largest reach and the most information on medical interpreting, including employers, educational opportunities, all kinds of things. So you really can't consider yourself a professional unless you're associated with a professional association. The diploma obtained from this school will increase your employability. Medio's diploma is well recognized and known not only nationally, but actually internationally, because it was the first online medical interpreting program ever. So even though there are a few now, Medio's is the most well-known and with the largest catalog of programs. CMI or CHI certification through the National Board of Certification for Medical Interpreters or the Certification Commission for Healthcare Interpreters can and will increase your employability and income as well. So we'll discuss those in further detail at a later unit. So this ends this presentation, and I thank you very much for listening.